A plague doctor was a physician who treated victims of bubonic plague during epidemics mainly in the 16th and 17th centuries. These physicians were hired by cities to treat infected patients regardless of income, especially the poor that could not afford to pay. Plague doctors had a mixed reputation, with some citizens seeing their presence as a warning to leave the area or that death was near. Some plague doctors were said to charge patients and their families additional fees for special treatments or false cures. In many cases these doctors were not experienced physicians or surgeons, instead being volunteers, second-rate doctors, or young doctors just starting a career. In one case, a plague doctor was a fruit salesman before his employment as a physician. Plague doctors rarely cured patients, instead serving to record death tolls and the number of infected people for demographic purposes.
According to Garrett Ray's Encyclopedia of Infectious Diseases, the first mention of the iconic plague doctor is found during the 1619 plague outbreak in Paris, in the written work of royal physician Charles Delorme, serving King Louis XIII of France at the time. After Delorme, German engraver Gerhard Alzenbach published a famous illustration in 1656, which publisher Paulus First's iconic Dr. Schnabel von Rahm, 1656, is based upon. In this satirical work, First describes how the doctor does nothing but terrify people and take money from the dead and dying. 21, 22, 23, 24. However, the costume was not worn by all medieval and early modern physicians studying and treating plague patients. Matteo fu Angelo in 1348 for 4 times at a normal doctor's rate of 50 florins per year. Pope Clement VI hired several extra plague doctors during the Black Death plague to tend to the sick people of Avignon. Of 18 doctors in Venice, only 1 was left by 1348, 5 had died of the plague, and 12 were missing and may have fled away. Plague doctors practiced bloodletting and other remedies such as putting frogs or leeches on the buboes to rebalance the humors. A plague doctor's principal task, besides treating people with the plague, was to compile public records of plague deaths. In certain European cities like Florence and Perugia, plague doctors were requested to do autopsies to help determine the cause of death and how the plague affected the people. Plague doctors also sometimes took patients' last will and testament during times of plague epidemics, 16, and gave advice to their patients about their conduct before death. This advice varied depending on the patient, and after the Middle Ages, the nature of the relationship between doctor and patient was governed by an increasingly complex ethical code. Some plague doctors wore a special costume consisting of an ankle-length overcoat and a bird-like beak mask. As an attempt to purify the air they breathe, it was believed that good smells would cancel out the diseases, and people would often walk around with a flower under their nose. The wearer would fill the mask with herbs and spices, commonly lavender. The plague doctors would also wear with gloves, boots, a wide-brimmed hat, a linen hood, and an outer overclothing. 21, 22, 23, 24. However, the costume was not worn by all medieval and early modern physicians studying and treating plague patients.